270-9933 is the number to call to talk to Zorba Pastor. We had the wrong number on the screen. 270-9933. Zorba is standing by in his office. Let's talk about the rising cases in young people and college students.
Right. Well, college students are less likely to have any symptoms. And so when it rises among college students, it rises among the general population because they intermingle. And now the data seems to show that even young children, children who are in middle school and children who are in high school are actually the least likely to have symptoms. And especially young kids would say 5 and under because you come into close contact with them, they come close to you, you nurture them, Mother Nature, and so on. They are also very likely to spread it because they are less likely to have symptoms. So it's a big issue. Now, as far as infants are concerned, there's only so much we can do, but from a college student point of view, it's a real issue. And I just read in the Chicago Tribune that the city of Chicago is asking the city of Evanston to fine anyone who's from college who is seen in a bar, and maybe that will cut down on the problems at Northwestern. And there are issues around. College students are going back. They want to be with one another, but the answer is be smart, wear a mask.
All right, we have calls coming in, and we will start with Malik in Madison. Hi, Malik. What's your question?
Hi, I have a question. What is the percentage rate of COVID, kids with COVID?
Kids with COVID.
I can't tell you today what the percentage rate is. Generally, if we keep it below 5% positivity, that's a positive sign. But if you want to know today's rate, I haven't checked it. Google what's today's percentage rate COVID positive, put in your town, and you can get that information on Google. That will be the most up to date.
And the university has, I think, a website now, too, that you can look at.
That's right.
Many different places. Just make sure you use reliable places, which means they're not political places to look for the answers.
All right.
Okay, who's next?
We have, we have a call, but
Sorry, Zorba, we're having a little bit of a technical issue over here.
we're in charge, I think, is the problem.
Well, let's talk, while we're waiting, let's talk a little bit more about this change in the advisory from the CDC.
Well, let's talk about what I would do if I were working with, say, in an industry where I was continuously, like we are, continuously worried about COVID. The answer is, if you're concerned, get a test. If you think you may have come into contact with someone, get a test. If you have a fever, of course, if you have a loss of sensation of smell, you're much more likely to have COVID. But the secondary issue is influenza. This is going to be the beginning of influenza season within the next few months. And influenza and COVID make a very, very bad mix. So the answer is now, and especially after September 1st, we should all start to get influenza shots because there's good evidence that when you boost your immunity to any virus, you boost your immunity to all viruses. So influenza virus may boost your immunity against COVID. There's also some interesting data that shows that even measles virus, which we immunization, which we don't get unless we need it, maybe even the shingles shot, maybe even other injections that we get may just boost our immunity and help us with COVID. So immunizations are important, especially important for our children, because a lot of kids have stopped being immunized, and adults have stopped being immunized because they're worried about going to the doctor's office for COVID. So get your shots.
All right, let's go to Lorna in Sun Prairie. Hi, Lorna. What's your question?
Hi, I'd like to ask Dr. Zorba, when a person is asymptomatic, what is the length of time that they can affect other people?
14 days. Length of time is 14 days. The first 2 days, you're probably not that able to actually infect people. We don't know for sure. The next 3 to 5 days, you're probably most infectious, but it's a 14-day quarantine. Most of the infectability is thought to be the first 5 to 7 days, but the answer is 14 days is tried and true. That's what seems to work for everyone as an absolute number.
All right, let's go to Kay now in Reedsburg. Hi, Kay. What's your question?
Last week, doctor was talking about getting our flu shots early and also the shingles shot. And I checked with the pharmacy, and Medicare does not cover shingles shots. And it's
Medicare actually covers shingles shots depending on whether or not you have Medicare Part D. So it depends on your insurance. I never answer insurance questions for people because it's there. But if you have Medicare Part D, that is covered generally by Medicare. Once again, always check with your insurance plan, and your pharmacy and we'll be able to tell you whether or not it's covered.
Okay, let's go to Jean in Oregon. Hi, Jean, what's your question?
Should people be concerned about carrying the virus on their clothes, taking it from if they get where they are to taking it home?
Clothes can carry the virus, but it's thought that clothes and topical surfaces are less likely. We thought that they were much more likely to be the source of the virus, but it turns out the most likely source of the virus is somebody you're standing next to, somebody who's talking, who's shouting, who's sneezing, or who's singing. Singing because you're projecting. So it's the droplets from people that are the most infected. Clothes are secondarily an issue. If you're working in a hospital, if you're around COVID, that's why, of course, we wear protective gear, because that's the most likely time we're going to be infected, because we're surrounded by the virus if we're in those very difficult situations.
And it seems like flu lives longer on surfaces than this COVID.
I think flu does. But once again, that's why wash your hands and make sure you do things of that nature to stay safe.
And wear a mask.
Zorba,
thank you.
Thanks for your patience, Zorba. Sorry about that. Thanks for your calls today, everybody. We'll do this again soon.